All right, correct. Before that, on one important note, we have three hot selling books during this 3 days conference. It is first come basis actually, as it's a limited stocks. The first one is Longevity Diet by Dr. Valter Longo. This one. The second book will be 7 Principles of Cancer Therapies by Dr. Antonio Jimenez. The third one would be Methods of Vitamin C in the New Age Medicine by Dr. Atswo. Actually, those who are interested to get these books, please visit our secretariat in front. Right? And before that, I know, Michelle, everyone is very enthusiastic for the next agenda, but it's for Malaysian delegates. It's a very important announcement. This is about our CPD point, a gentle reminder again for successful CPD points to be accumulated in the individual system. Please scan before 5:30 p.m. each day. Thank you on that announcement. Yes, Michelle, over to you.
Okay, let me introduce our first keynote speaker. He has obtained his undergrad and postgraduate degrees in biochemistry and pathology in very prestigious institutions in the United States, as well as his postdoctorate degree in gerontology at the University of Southern California, where he is a professor of gerontology and biological sciences and the director of Longevity Institute. Our keynote speaker has created a nutritional breakthrough, fasting mimicking diet, designed to provide the body with natural, nourishing ingredients while not activating any of the pro-aging process. As fasting mimicking diet has rapidly gained traction and recognition across the globe, his endeavors represent the very forefront of modern medicine and have changed how clinicians advise patients regarding wellness and longevity. Let us give a very warm welcome to Dr.
Valter Longo.
Okay, thank you very much. Thanks for the invitation. I'm very happy to be in Malaysia. It's the first time for me to be here. It's a very beautiful country. Hopefully I'll visit some of it in the next few days. So I'll get started. And so I always start my talks with this question, how many years, additional years of life do you think we will have if we cured completely cancer? And usually you get these answers, 20 years, 25 years. So if we had no cancer, we will live a lot longer. But the reality is that we only live about 3.2 years longer, even if we didn't have cancer at all. And what if we cure cancer, heart disease, stroke, and diabetes? Now most people will say maybe 20, 30 years. And again, it's only about 13 years. And then on the right is a little bit of a speculation, but a speculation based on what we already have achieved with simple organisms, mice, etc. And basically saying, what if we were half as good as we've already demonstrated for mice in extending the human lifespan and health span? Then this would be 30 years, right? So now we have mice that we can make live twice as long and much, much healthier, and we'll talk about it in a second. So how do we, first of all, I always, I cloned this word called juventology, and I was really surprised that, after 3,000 years of research on aging, everybody's always talking about gerontology, right? Studying aging, and not juventology, which is studying youth. So how do we stay young? A school of gerontology, the world's first school of gerontology in Los Angeles, and I always thought it's not so interesting to figure out why things are aging. It's much more interesting to figure out how do things stay young? How does an organism stay young? And that's really what I'll talk about for the rest of my talk. And so I like to go around the world and talk to centenarians, and every centenarian has a different story, right? And journalists love to talk about stories, and they're just stories. And in this case, Gertrude Baines in Los Angeles, she got to 115 years of age, and she said that basically she got there by not drinking or fooling around. And Salvatore Caruso, who is from the same town that my parents are from, he lived to 110. And he also said something like, no wine, no tobacco, no Venus. That was his formula for longevity. And then, you know, you have Madame Calment, and Madame Calment from France didn't follow any rules, and she smoked until she was 117, and drank and ate a lot of chocolate, and so. You know, why is that? Also Emma Morano, I followed her for years, and she made it to 117. And the journalist, that there was a big article in the New York Times saying, oh, she ate 3 eggs a day and meat almost every day. What the New York Times didn't say was that she had 6 brothers and sisters, and also her parents, all of them made it over the age of 90, which really told us one thing almost for sure, which is the genetics of aging, right? So some people, very few people, have the genes that, like Emma Morano, allow them to get to very, very old ages in spite of everybody else getting diseases. So they're really protected from all kinds of diseases. And what are those genes? And that's really, again, about juventology. What are the genes that keep these families young and allow them to, in fact, have very poor lifestyles and still make it to an old age, right? Again, this is rare, but it teaches a lot about aging. So, you know, back in the early 90s, a few of us, mostly in the United States, started thinking about, you know, we want to know. There was not a single gene known to regulate the aging process. So I started actually working with humans and mice, and soon realized in the laboratory Roy Walford at UCLA, and soon realized that it wasn't going to take us anywhere. So we had to go back to simple organisms, and particularly yeast, flies, mice. But the initial work was really with microorganisms, simple organisms. So it was mostly yeast, flies, and worms. And so several groups, you know, I picked yeast and others picked these other organisms, and the idea was, what are the genes? Let's identify the genes that control aging. And from this, we were able to identify what's called the TOR-cis-kinase pathway. And this, if this yeast is unicellular organisms that are used to make bread, if they have mutation in this gene, they live up to 10 times longer. So they completely reprogram their youth span, what I call youth span, and also lifespan. And similar results were found in worms and flies, and the genes were fairly similar. And in mammals, these little mice here have the record lifespan extension for mammals. They live up to twice as long, and they have a mutation in the growth hormone receptor. So either mutations in the deficiency in growth hormone or deficiency in the growth hormone receptor causes very long lifespan extension. And part of it is probably due to low IGF-1, but also low insulin and low TOR-cis-kinase activity. So the reason why these mice live so much longer is related to these genes inside the cells, particularly TOR-cis-kinase, AKT, and also something called PKA. The remarkable thing about these mice is not just living twice as long, but is living much, much healthier. So now, if you wait until the end of life, only 50% of these little mice will develop diseases versus 90% of these normal-sized mice, right? So it's really a five-fold increase in the disease-free state. So you live a lot longer, and you really cut the disease state by a tremendous amount. Okay, so then as we were looking at yeast and mice, and others were doing mice, everybody was asking, of course, what about people? This may just be something that is peculiar. It has to do with simple organisms, and not really people. So I started studying the individuals that have growth hormone receptor deficiency, the same mutation as the mice that I just showed you that have record longevity and health. And I was lucky enough that Jaime Guevara in Ecuador, is an endocrinologist in Ecuador, was following about 100 of these individuals. And so we started studying them, almost, I think, 12 years ago or so. And the first thing we realized that they had a very bad lifestyle. And I thought, it's going to be difficult. Being a student of Roy Walford and somebody that was working in calorie restriction, I thought that it's going to be difficult for these individuals to have extended longevity, considering how poor they drink, they eat a fairly poor diet, they don't exercise. But anyways, we studied them anyway, and soon realized, for example, if you look at cancer deaths, in the relatives, you have the expected 20-22% of the deaths caused by cancer, and in the growth hormone receptor deficient people, thus far, we only seen one cancer death in 50 years or so monitoring. And the same is true for those that Zvi Laron has been following in Europe and the Middle East. So out of 350 people now, only one person has died of cancer. One person with this mutation has died of cancer in 50 years of observation. So it's really remarkable. And importantly, it matches the data from mice, right? So together, I think, it's starting to make a convincing case that this genetic mutation is very powerful in preventing cancer. And the other thing we saw was these individuals, if you look at Ecuador, the prevalence of obesity is about 12%, and the prevalence of obesity in these subjects is higher. So you would expect a very high diabetes rate, but instead you have a 5% prevalence of diabetes in Ecuador, and so far we haven't seen a single case of diabetes. It doesn't mean they're not going to develop it. Some of them look like they're going to develop it eventually, but it's still extremely low prevalence of diabetes, and the same is true for other regions of the world. So they're protected from diabetes, they're protected from cancer, and again, the mice that have the mutation are insulin sensitive in spite of obesity. So very similar results between mice and humans, suggesting that these are in fact true facts. Then we brought them to Los Angeles. We brought 30 of them to Los Angeles. We were interested. We knew that the mice had improved cognitive decline, improved cognitive performance, lower cognitive decline. So their brain was younger at older ages. And so we did functional MRIs. And this is just the functional MRI where people are asked, they're shown objects and they're asked to decide whether they've seen the same object, they've seen something similar, or the object is new. And that way we can, this is not showing very well here, but basically all I want to show you is that the pattern of recognition is much more similar to that of young adults, and there are actually 20-year-olds. So the GHRD have a performance, a brain performance that is much more like the 20-year-olds compared to the 70-year-olds, which is what we saw for the controls. Right? The controls, you see they have especially when you look at the objects that are similar, they behave much more like 70-year-olds, and the GHRDs behave much more like 20-year-olds. Perform much more like 20-year-olds. So they're more youthful brain phenotype, again, as we've seen for the mice. Okay. So what about diet? And so there's not much we can do about genes, and so the diet now can control the genes that control the aging process. And so the one thing about diet that has been studied for a long time has been calorie restriction. This is very simple. What happens if you just restrict? You take a normal person, not an overweight person, and you take that calorie intake and you reduce it by about 25, 30%. That's calorie restriction. It's very simple. And so finally, after maybe 80 years of studies in simple organisms, Richard Weindruck, that came from the same lab I came from at UCLA, he decided to do a study in monkeys. So for 25 years, they restricted these monkeys by 25%. And you see that the results are remarkable, but there's so lots of benefits and lots of problems. So let me show you the benefits. The benefits is 60% of animals on the normal diet develop insulin resistance or diabetes, and this is completely absent in the calorie-restricted monkeys. Tumors and cardiovascular disease reduced by 50%. Right? So really remarkable results. And this is the death caused by age-related disease. This is the calorie-restricted, and this is the controlled diet monkeys. But look at the death caused by all causes. Now the curves are much closer to each other. So suggesting that there are trade-offs. So this calorie restriction has incredible effects on diseases, but still it cannot do much to lifespan. So the idea then is, okay, let's look at people. So same thing for people. Walter, this is my mentor back in the days in the 1990s. He did this first, he went in this Biosphere 2 area of Arizona and did the first human calorie restriction study. And the results were remarkable, and I'll just show you some examples of it. For example, if you look at systolic blood pressure, this is when they enter Biosphere, look at how it drops. And they're very healthy blood pressure, and it still drops from 110 to 90. Cholesterol drops from 190 to 125. Glucose, glycemia drops from 90 to 70 or so. So it's really the kind of changes that most doctors will say it will protect you from many, many different diseases. And but if you look at the Walford while he was in this Biosphere 2, he looked very thin, right? So is pushed to an extreme, and this push to an extreme is probably what's causing the trade-off, right? So for example, we know that when you're pushed to this extreme, your immune system can become weaker, your wound healing can become weaker, et cetera, et cetera. So now, of course, you think, based on what I just showed you for the monkeys, that at least half of the funds in health research should be focused on this. How do we get zero diabetes, 50% cut in cardiovascular disease, and 50% cut in cancer without having to look like this and be pushed to an extreme, right? So I think the research in calorie restriction showed us it can be done, but it showed us this is not the way, And people always love to talk about, old stories, old ideas, and they say, people used to do this 10,000 years ago. Well, usually those things, have benefits, but they also have problems, right? So I always say the solution is in combining tradition, these old things, with technology. Once you combine the two things together, then you're really starting to get things that can work, right? So what's the technology here? And so, I knew from my work back before I even worked with Walford, I was working with bacteria, and we're working with yeast. And I noticed when I starve them, they live longer. You think that you starve them and they'll starve them to death, right? But this simple organism, if you completely starve them, they start living longer, and they became very tough. They became protected against all kinds of toxins, right? So I thought that interesting, right? These organisms have been separated by hundreds of millions of years. How could they respond the same way to starvation? And I started thinking there must be something conserved, something very fundamental about starvation responses that is conserved. And this is true also for worms, right? So you starve and they live longer. Yeast, they live longer. Worms, they live longer. So what is it about starvation? Complete lack of food that is so powerful in making organisms so far away from each other live so much longer. And so I started, of course, I'm jumping ahead, 20 years, and the idea was the following. First was, what if we just starve a system, let's say a mouse or a human being, for a few days, and we push it to this extreme, and then we stop, and we go back to the normal diet? What happens then? And then first we did it with water-only fasting, and then eventually we developed a fasting mimicking diet. Why? Because cancer patients and oncologists cancer patients did not want to fast, and oncologists did not want them to fast. So with help from the U.S. government, we developed this low-calorie, low-sugar, low-protein, high unsaturated fats, vegan fasting mimicking diet. And that was the idea, to replace fasting and still get the same effects on IGF-1, IGF-BP1, glucose, and ketone bodies, right? So the same effects as water-only fasting had to be achieved by this fasting mimicking diet, and they are achieved. Okay, so then what if you take a mouse and middle age, you take the mouse at middle age, and you start giving 4 days of this fasting mimicking diet twice a month, just 8 days a month, and the rest of the time they can eat whatever they want. And you see that already this is the white blood cell count. It drops with aging, and then you see that after 8 cycles of the fasting mimicking diet, the white blood cell count goes back to the young cell count, suggesting that there is rejuvenation of the immune system. And this rejuvenation of the immune system, you will expect it to help against tumors, and you see a big effect on tumors, about 45% lifelong decrease in tumors, but also you see all these dots are the tumor development starting at 21 months in the control diet mice, and here you only see one for the fasting mimicking diet. So all these tumors here are prevented by all these early tumors are prevented by the fasting mimicking diet. So there's an overall 45% decrease, but also everything is pushed back. So really very powerful effects of these, short cycles of FMD in preventing cancer, probably in part by boosting the immune system. And we're going to see some examples of that. Okay, so what about if you give them cancer? What if you give lung cancer and breast cancer to these mice? You inject millions of cells, and I just show you the cure rate, right? Cancer-free survival. How many mice can we cure? They have already this cancer. And if you give them no treatment, of course, the cure is 0. If you give them chemotherapy, most people don't realize it, but even in mice, chemotherapy does not cure almost anything. And if you give them fasting, that does not cure anything either. And similar for breast cancer. Now, if you combine fasting with chemo, now you see this big jump in cancer-free survival, both with the lung cancer and the breast cancer. And this is actually FMD, fasting mimicking diet. And so this is, again, what I was saying earlier, combining tradition, the fasting mimicking diet with the technology, in this case, the chemo. But, of course, now we're applying it with all kinds of different therapies, not just chemotherapy, but also, immunotherapy, kinase inhibitors, etc. Okay, so why does it work? Well, I didn't talk about protection very much, but the fasting mimicking diet, now it's very clear from many, many studies that we and others have published that it protects the normal cells, the healthy cells. It protects them. Normally, lots of healthy cells are killed by the chemotherapy, as well as some cancer cells. And now you have more deaths of the cancer cells and also less death of the normal cell. And this is what we call differential stress resistance and differential stress sensitization. So the normal cells are protective during the starvation conditions, and the cancer cells are sensitized to the chemotherapy. Okay, so what about immune effects? And we started suspecting that some of these effects were caused by an immunotherapy-like induction. And so here is a triple negative mouse breast cancer, and a fasting mimicking diet slows down the progression of the breast cancer. And if you look at the cancer, you see the infiltration. Normally, you have low infiltration of T cells in the tumor. If you give them the diet, low infiltration. If you give them chemotherapy, low infiltration. Now, if you give them the combination of the diet and the chemo, now you see high infiltration. So the immune cells are now recognizing the tumor cells much better with the combination of chemo and fasting mimicking diet. And also the T regulatory cells are moving away. So the inhibitory cells are lower, and the cytotoxic T cells are higher in the tumor. Okay, and here is the demonstration. If you block the effect of the immune system, now you have an acceleration of the tumor growth during fasting mimicking diet condition, demonstrating that in fact it is the T cells that are causing the killing of these breast cancer cells. So it's now reactivating the ability of the immune system to recognize breast cancer cells. Okay, so here is just a summary. Here is fasting mimicking diet is acting, and this is really the power of this, is acting on so many things. It's acting on glucose, on IGF-1, on autophagy, heme oxygenase 1, immune cells, etc. So now this is very coordinated effects that we think are very wide, and so the importance of this is why it needs to be combined with some targeted therapies, because the targeted therapy is very powerful, but it's also usually met with the ability of cancer cells to get around it, right? So chemotherapy works for a while, even immunotherapy, kinase inhibitor, and then the cancer cell, a minority of the cancer cells now develop resistance, and then this therapy is not very effective. So the FMD is so wide-acting that when they try to develop resistance, they fail because so many of the things are modified. And so IGF-1 and glucose and insulin, et cetera, it's very difficult for the cancer cell to escape this, I call it death by confusion, to escape the very complex environment that is now being generated by the combination of the therapy and the diet. Okay, so what about clinical trials? The first one, I'll just go through it briefly. The first one was done at USC, 18 patients, comparing 72 hours of fasting with 24 hours of fasting together with chemotherapy. And in general, you see a lowering of the side effects caused by chemotherapy. Then the Leiden University did a study, a small randomized study, showing that the fasting, actually this water-only fasting, protect the erythrocytes and thrombocytes against chemotherapy induced toxicity. And then the Charité Hospital did a study in women with ovarian cancer and breast cancer, showing that this is the 3 cycles of chemotherapy together with fasting and mimicking diet, and you see no changes. So these women at the beginning and the end are about the same. So their quality of life does not worsen with cycles of chemotherapy. And if you look at the normal diet instead, you had a significant drop in the quality of life. And this is suggesting that, in fact, the fasting mimicking diet is protecting against, consistent with the other study, against chemotherapy toxicity. Now, this is an unpublished study, so please do not take any pictures. This is by Leiden University, and it's 125 patients, randomized clinical trial, and basically showing that the patients that did the fasting mimicking diet and they were compliant to the fasting mimicking diet, you see a much higher response of the much higher level of tumor-free, and this is women that received chemotherapy before surgery. So at the surgery time, now they looked at they took the masses and they did pathology on the masses, and this is the result of this pathology, showing that they're much better. The FMD, the patient that did the FMD together with the chemotherapy did much better in tumor-free masses or 90% tumor-free masses. This is the Miller Pain 4 and 5 score. And then when they look at clinical response by MRIs or ultrasound, again, you see a tremendous effect. So if you just look at the non-responder, so the patient that were stable with the stable disease or progressing disease, it went from 27%, nearly a third of the women, to 5%. So it's like a 5-fold decrease in the non-responders, suggesting, as I just showed you for the breast cancer in mice, that the diet is sensitizing the cancer cell to the chemotherapy, and now almost every woman that was FMD compliant now is responding. The masses are responding to the chemotherapy. Okay, so again, this I already explained to you, this wide-acting effect, and now the interesting thing is going to be combining the fasting mimicking diet with metabolic drugs. What about drugs that block different metabolic pathways, and how can we get differential? And the key is really differential effects, right? Different effects in normal cells and cancer cells, and this is really been understudied, and that's, I think, this lack of planning has really been responsible, I think, for just poor success by cancer research in the last 30 or 40 years. I mean, there is success, but it's not the kind of success that we expected. And I think a lot of it is because there's too much technology and not enough thinking about the problem that we're trying to solve. Okay, so then I started thinking, how is it that you could take a 40-year-old couple, 45-year-old couple, and you can go from relatively old systems to a young and almost perfect zygote, and then eventually baby, right? So how does the body? So the body must have a way to zero everything, meaning take everything old, get rid of it, and make it young again, right? So otherwise, how is this happening, right? How can it be so effective? So, and then I started thinking, maybe fasting is the moment where there is selection of damage and there is disposal of damaged components, and then the opportunity to rebuild, right? Both at the cellular level and at the organ and systems level. So what if we take autoimmunity? So now you're developing, and this is an encephalomyelitis model in mice, where you just inject a protein in the mouse and they develop autoimmunity, and so this is starting the immune system now starts to attack the myelin in the spinal cord, and you start seeing this pathology. This is the control. So most of the mice now develop very severe pathology, multiple sclerosis-like pathology. And if you give them a continuous ketogenic diet, that helps, but not very much. And by day 30, if they're on a continuous ketogenic diet, the autoimmunity is about the same as in the control diet. But if you do it, if you start cycles of the fasting mimicking diet, then you see that the pathology stops, and then they start coming down. And for about 20% of the mice, the autoimmunity is completely removed, and for about 50% of the mice, you see a really major decrease in the autoimmunity, suggesting that the fasting mimicking diet is effective in at least drastically reducing the pathology. And so how does it do that? Well, we see effects on decreasing inflammation, so the infiltration of T cells. So it's exactly the opposite of what it's doing for cancer, right? This is why you're starting to see the pattern of evolution, meaning that this is not just happening by chance. This is most likely an evolved process, and this is why I call it 3 billion years of research and development to get there. So it can tell that the cell is damaged, and in this case, it's an autoimmune cell. And so now, instead of infiltrating the spinal cord, you have a much lower infiltration of the T cells, and this results in much lower demyelination, so the removal of myelin from the spinal cord, and therefore the multiple sclerosis effects. Okay, so why does it work? And these cycles of the FMD work because on one side, again, they can target preferentially the autoimmune cells, and they remove them and kill them. And on the other side, they activate the oligodendrocyte precursor cells. So they activate the stem cells or the stem-like cells, and they now can begin the rebuilding process, right? So they rebuild the myelination of the axon, but you have to remove the inflammation and the autoimmunity. Otherwise, this is a futile process because as you make new myelin, it's going to get attacked again. And this is really why we think that regenerative approaches like stem cell-based approaches for lots of diseases have a limited value because you can put all the stem cells you want in here, and they're going to keep getting attacked by the immune system. And so it's really a futile effort. Okay, so what about patients? And this is a preliminary 45-patient clinical trial. But already you see that patients, and these were either a ketogenic diet or a fasting mimicking diet, a single cycle of fasting mimicking diet. And you see already the quality of life improvement is better with the fasting mimicking diet. So a single cycle of the fasting mimicking diet is superior to 3 to 6 months of a ketogenic diet. So you see improvement in quality of life, both physical and mental. So preliminary now, we are starting in different sites, randomized, larger clinical trials, multi-center, testing the FMD with multiple sclerosis. Okay, so what about another autoimmunity, Crohn's and colitis? This is a paper we just published, and Priya and Yin-Yang in the lab looked at the Crohn's and colitis. And in Crohn's and colitis, you have basically a failure of the epithelial barrier, and eventually, components of the diet or of the microbes are getting in contact with the immune system. The immune system start attacking the intestine or intestinal components. And so the test here was, what about if we use this sulfate sodium model, we generate an autoimmune-like inflammation in both the small intestine and the colon. And you see here, this DSS causes a shortening of the colon and 3 cycles or 4 cycles. And then you start the fasting mimicking diet after the colon is already shorter, and you see the colon length. Now the colon extends again. So it's really, truly regenerating effect of the cycles of the fasting mimicking diet and refeeding, able to reverse the effects of the DSS on colon length. And so here you see they're going back to the normal length. And why is this? Well, in part, again, as I just showed you from multiple sclerosis model, is the infiltration. This is the small intestine. You see that there is increased infiltration of CD4 cells and CD8 cells, and the FMD is able to reduce this infiltration. So again, it's reducing the autoimmunity, and that's definitely one of the components of these effects on the disease. And on the other side, again, the regeneration. You have intestinal stem cells in the crypts of the colon. And here you see that the DSS treatment causes a decrease in cell proliferation in the intestine, and the FMD reverses this. It may even cause a trend for an increase compared to the naive mice, right? So it's really one of the organs that's most for which the fasting and fasting mimicking diets are most effective. So it really shrinks and then re-expands during the refeeding period. And this re-expansion, you see, these are LGR5 stem cells, intestinal stem cells. There is a major decrease with DSS. And then if you do FMD, you see the reversal of this decrease. So this is really stimulating the stem cell, the increase in stem cell number, and also the regenerative effects. Why is this? And part of it, we think, is due to the reshaping of the gut microbiota, meaning that these lactobacilla, bifidobacteria, and other species that are associated with protective anti-inflammatory effects, now they go from 16% to 58%. So it's really the cycles of fasting mimicking diet and refeeding are completely changing the gut microbiota. And if you look at the, if you just take lactobacillus and you force it into the mouth, basically, you could do this gavage, you see that you increase the cell division, you increase the level of stem cells, and you also reverse the shortening of the colon length. So not all the effects of the fasting mimicking diet are repeated by just taking this protective bacterial population, but certainly lots of them are recapitulated by this intervention. So the microbiota change seems to be central in these effects. And we know that the microbiota can talk to the immune system. And so and this microbiota is talking to both the immune system and the stem cells, causing, again, this dual effect. And this is just to show you that water-only fasting was not effective. And actually, the water-only, you cannot see it here very well, but water-only fasting actually increased the leakage of the gut, right? So it's interesting how the FMD now, the vegan FMD, is superior to the water-only fasting. And we think the reason for that is this, that there's prebiotic ingredients in the fasting mimicking diet. And these prebiotic ingredients are feeding this population, the lactobacillus, the bifidobacteria, etc. So going back and forth from this to the normal diet is causing this expansion of this protective population. And now we think that this is really, together with the starvation, this microbial repopulation is causing these protective effects. Okay, here is just a summary of what I just told you, is the water-only fasting has some of the effects, but the fasting mimicking diet has effects on stem cells, on microbiota, inflammation, and regeneration. And I think that this coordinated effect is really what you want. And again, is what I said earlier, and I keep saying it, tradition and technology, you put them together, and they seem to work a lot better than one or the other alone. Okay, so what about diabetes? We took the really tough model. It's called DB mice, the leptin receptor deficient mice. They develop obesity, they develop hyperglycemia, and then you see the mice start dying of hyperglycemia. And if you allow them to develop hyperglycemia, and then you start the fasting mimicking diet cycles here, you see that the glucose level come down, and they stabilize even after you stop the diet, right? So it's really powerful insulin sensitizer. But this is not really what we were worried about here. We were more worried about, interested in the regeneration. So the red are pancreatic insulin-producing beta cells. And you see that at the beginning, you have insulin-producing beta cells. This is it's called STZ type 1 diabetes model. The other one was type 2 diabetes model that I just showed you. This is type 1. So you damage you take STZ, you see the pancreas now no longer makes insulin, and it's all no red left after 5 days, and after 50 days, no insulin generation either. Now, if we start the fasting mimicking diet at this point, you see that this is blood glucose comes down. Eventually, it comes down to normal levels or close to normal levels. Then we stop the diet, and this stays for a very long period. So meaning that the mice are now, the pancreas is now being reprogrammed and is now making insulin again. So it's replaced the damaged insulin-producing beta cells with functional ones. And now the mice are fine. So now we're starting a clinical trial at University of Genova, Gaslini Children's Hospital, looking at type 1 diabetes. We actually have 3 trials on type 2 diabetes, but now we just had a clinical trial on type 1 diabetes. It's very interesting. It's going to be a tough one, but let's see what happens, and we will know in about a couple of years. Okay, so why does this happen? If you see that this is just a lot of genes that are expressed during embryonic development. These are the type of genes that cause the generation of the pancreas in the first place, when we are first born or when the mouse is first born. And you see that in the regular diet mice, all these genes are turned off. So they're all shut off. Of course, there is no development. There is no embryogenesis in an adult mouse. But if you look at the adult, mouse with the fasting mimicking diet, you see how all these genes turn red. It means that the starvation condition are now causing they turn on this regenerative, embryonic-like regenerative process. And even one day after refeeding, so this is during the fasting mimicking diet, and this is day 1 refeeding. So you starve them, and then you refeed them, and lots of these genes are still on, right? And 2 of them, one is called SOX17, one is called NGN3, and they're both involved in the development of the pancreas when we are first born. And they seem to be, especially NGN3, was shown to be essential for these regenerative effects of the fasting mimicking diet. So what is happening is that I didn't talk about the mechanisms, but certainly the fasting mimicking diet is reprogramming lots of these genes. One is called PKA, one is TOR. These in turn control these embryonic development genes, SOX2 and GN3, SOX17. And now the pancreas, and this is what I was saying earlier, is really coordinated effect, and is going back to hundreds of millions of years ago, if not billions of years ago. And of course, it makes sense. I always say, if you cut yourself, the system is able to recognize that cut and turn on all the cells, and is able to, within a couple of weeks, repair this to almost perfection. And if you think about it, it would be really unlikely that we have this perfect, beautiful system to repair outside skin, but we have nothing for the inside, right? If something gets damaged on the inside, we have nothing. It's unlikely, right? And so potentially, the starvation periods are the moment where the inside is given the message, now it's time to fix the damaged components, replace the damaged components with new ones. And this is why this working with so many diseases, because in diabetes you have insulin resistance, in multiple sclerosis you have autoimmunity, in Crohn's you have autoimmunity. So there are things that are going wrong. You're attacking yourself, and there is nothing to attack. So the fasting mimicking diet seems to reset the system and make it understand that there is no foreign antigen. Don't attack it, or in this case, the insulin resistance is not appropriate. Let's sensitize the system again. Okay. So what about human trial? And we published this a few years ago, 100-patient randomized trial, 3 cycles of the fasting mimicking diet, once a month for 3 months, and then we measure baseline, and we measure after the 3 cycles. And you already see big effects on body weight, abdominal fat, waist circumference, and what you don't expect, which is the lean body mass, the relative lean body mass is actually going up. So the absolute lean body mass stays about the same, but relative to weight is now going up, right? So you're not really sacrificing muscle mass for the sake of weight loss. And if you look at blood glucose, and this is a big difference with calorie restriction. Remember, calorie restriction in the human study, you saw people starting with a good glucose level, and it keeps going down and down and down, and it reaches very low level in the 60s and 70s. Here you don't see that. You see that people that have normal blood glucose, there is not much of a change. And people that are pre-diabetic, now you see a big drop. And same thing for IGF-1. People that are normal, you see a drop. And people that have high IGF-1, you see a much bigger drop. Systemic inflammation, C-reactive protein. Again, nothing happens if you have normal level of CRP. If you have high levels of CRP, then you have a big drop. And cholesterol, small if you have normal cholesterol, and big drop if you have high cholesterol. So, we don't know yet. Is it the stem cells? Probably the stem cells are contributing. We're starting to see some evidence of circulating stem cell increase, as you will expect based on all the things that I saw you from mice, but we don't know yet. This is much harder to do in people than it is in mice. And so in general, disease risk, diet, age, and genes, and we now have evidence. We're trying to calculate the actual biological age after cycles of the fasting mimicking diet, and we're trying to also calculate disease risk. If somebody just did the fasting mimicking diet 3 times a year, we think most people will only have to do it for 3 times a year for 5 days. So it's really the idea is to do a very limited amount of the year. So 15 days a year total could really have tremendous effects on disease risk and also potentially lifespan and health span. And so why all of this? And I just summarize it. Usually I like to show Walford. And Walford before the Biosphere 2, then he goes, showed you the picture earlier, and really it's just about shrinking. It's just a very simple concept, right? In this process, as he's starving, the whole body shrinks. Of course, the fasting mimicking diet is nowhere near this. It's 5 days of about 900 calories a day. So it's much, much milder, much, much safer. But this is just, I want to show you the extreme case to prove the point. So now his liver is now probably shrunk by 50%. It's much smaller liver. And we know these mouse studies, everything shrinks tremendously during this period. And then he refeeds, and this is a year after Biosphere 2, and it just re-expanded, right? So now you imagine if you're having to regenerate health liver and lungs and everything else, how are you going to do that? Well, most likely you're going to go and utilize the embryonic development strategies, right? You utilize what you've always known how to do is build organs. So this is now incredibly powerful and very coordinated. Why is it very coordinated? Because it's been there, for a long, long time, and everything has to be perfect when you rebuild. Now, keep in mind that we come from a past where we used to eat a lot in the summer, become fat, essentially, and then use that like we see for the bears, for the emperor penguins, et cetera, become fat, become insulin resistant, and then starve during the winter, and use that fat that we store during the summer for fuel, right? So this is really part of our history, and this is why these cycles of normal weight and very low weight, and normal weight it's very normal, and of course, again, this is an extreme scenario, but certainly these cycles are very normal, and we think they're at the center of these very coordinated regenerative and rejuvenating effects. And that's all I have. I think I already thanked everybody, so thank you very much.
Thank you, Doctor. We open the floor for question and answers. We appreciate to go to the mic so the benefit for everyone. We welcome questions.
Hello. Hi, Dr. Longo. I have 2 questions. My first question is, how do you monitor the body when you are in a fasted mimicking diet? Is there a way that you can actually monitor it through ketones? How do you do that?
Yeah. So you monitor. We usually, this is why I showed you, even in the cancer trials, we do IGF-1, ketone bodies, and glucose. We always do those three, and that's how we can tell whether a cancer patient has cheated or has actually followed the fasting mimicking diet. And sometimes we do IGF-BP1, and that's a fourth very nice way to determine it, particularly protein intake. IGF-1 and IGF-BP1 are very responsive to protein intake. One goes down and one goes up.
I see. And my last question is, which has a better growth for stem cell? Is it FMD or just straight out fasting?
Well, we moved away from straight fasting because, some of the reasons that I showed you, but also because of safety. The water-only fasting, it can be done, but usually we say it should only be done in clinics, like, the specialized clinic with medical personnel. For people to do it out at home, we've seen many, many cases of problems, so we now say, because of many, many reasons, do the fasting mimicking diet. The expense is minimal, a couple of times a year. Most people do it a couple of times a year. And, hopefully, and this is something we're discussing here, hopefully at some point will be reimbursed by governments. We need to do a little bit more studies, but I think soon enough we'll be able to make a case that it should be reimbursed.
Thank you very much.
Dr. Edward Chan from Valter, Kuala Lumpur. Dr. Longo, what do you think? Do you think there will be additional benefits if we combine the ketogenic diet with the fasting mimicking diet?
Depends for what, right? So I always say this is really, we need to move away from generic things like, words like ketogenic diet or intermittent fasting, and we need to move into what medicine has done, very precise definition, right? What do we mean by intermittent fasting? What kind of fasting exactly? What does the diet contain? And same thing for ketogenic diet. And then for what, right? So for example, now we think that combination could be useful for certain cancers, but it's not going to be useful for other cancers. We know that ketogenic diet actually accelerates the growth of many cancers. So it reduces the growth of many cancers and accelerates the growth of other cancers. But for those in which the ketogenic diet does decrease the growth, it could be very interesting to say ketogenic diet plus fasting mimicking diet plus standard of care. So all three together could be very powerful. For example, now for glioma, we're starting to think about combining the three.
There are much research to shows that growth hormone can do cells repair as well. Now, with fasting mimicking diet, you are in effect negating growth hormone, human growth hormone. How do you explain this?
Yeah, I mean, in the book, if you have a chance, please pick it up. I don't make a penny out of it, so everything goes to research. But I talk about 5 pillars, right? I said, we got to stop having a one-pillar strategy. Like this idea of growth hormone causing stem cell activation is maybe half a pillar to one pillar. What does it mean? It means that as you look at clinical studies, epidemiological studies, basic research, and centenarians, etc., you realize that that's not true. Meaning that most of the centenarians are on a low protein and they have low growth hormone, low IGF-1 diet, right? Whether it's Okinawa or is Loma Linda, California, or is Sardinia, etc., etc. So, and if you look at mice, the mice, in all organisms with growth hormone deficiency, they're the ones that have record longevity. I mean, not just a little bit of extension, record longevity. Nobody's ever found anything more powerful than knocking down growth hormone or growth hormone receptor. And so why do you see effects of growth hormone? It's kind of like insulin resistance, right? Insulin is actually a good thing. So if you were doing a one-pillar study with insulin, you conclude insulin is great. Let's give everybody lots of insulin, right? Let's say you go back 40 years and you say, hey, I inject the patient with insulin, and this is exactly what happened. And they do great, so let me just give them a ton of insulin, right? Every day, let's inject them. And that's exactly the one-pillar strategy with growth hormone. Yeah, sure, you're going to get some benefits. In the long run, you're going to die earlier.
Morning, Dr. Longo. I would like to ask the difference of FMD. You are using the fast making diet, water fasting. Can you please advise us on the dry fasting?
Yeah, the water fasting is, people do it, but water fasting is kind of like what I showed you with calorie restriction, right? You're going to get lots of good and lots of bad, right? And yeah, people always like to talk about the good. Nobody ever talks about the bad. Like calorie restriction, say 99% of my colleagues will always say positive things about calorie restriction. But the reality is, after we torture the poor monkeys for 30 years, they live about the same, right? They had no diabetes, and yet they lived about the same as the monkeys that ate normally, right? So yeah, so water-only fasting reminds me of that. And it's going to cause lots of benefits, lots of problems. For example, hypotension, hypoglycemia, I showed you the leakage of the gut is actually increasing, right? So yeah, I think that the water-only fasting is an old idea. It can be beneficial, but if you do it too often, you're also going to see the problems. With the fasting mimicking diet, we're starting to sort of remove the problems and keep the good and remove the bad. That's the idea, right? And make it much more feasible for people, and also make it very inexpensive. We're not trying to now come up with an expensive intervention. It should be inexpensive, but it should be or free, reimbursed by the government. But I think it should be safe for people. Otherwise, we go back to just difficult procedure that ends up with no beneficial effect, and in fact ends up damaging some people, right?
In your FMD, you use your diet, you more of the plant diet. There's not so much of animals and lack of proteins. If I want to start patients cancer patient with cachexia, how much protein that I should give these patients?
I'm not sure what your question was. The fasting mimicking diet, we tested it now with close to 500 patients, cancer patients, just cancer, about 500 patients, and the weight loss and the cachexia is minimal. In fact, in the study that we're about to publish from Geneva, when the women did the fasting mimicking diet, and then they were given a light exercise for just 20 minutes of weight. Just light weights, they gained lean body mass, right? So, and I fought with the nutritionists because they give them too much protein in between cycles of FMD. I say, keep the proteins normal because they don't need it. And they say, no, because they're going to be cachectic. And we try to convince them, they couldn't do it, But sure enough, they actually gained. So now we're saying, if we had given them normal protein, they would have stayed stable, and we will have gotten benefits both at the level of protection of the patients and also the sensitization of the cancer cells.
My last question: one cycle of your FMD is 3 times every month, 5 days in a month for 3 times?
No. One cycle of the FMD is just one cycle, 5 days. 5 days. So we think most people should only do it maybe 3 times a year total for 5 days. So 15 days a year total. Yeah, that's more for most people. Now, if you're somebody obese with high blood pressure, high cholesterol, that person might have to go to once every 1 or 2 months until they move to a better state, and then they can go back to. Once you're very healthy, maybe twice a year. You don't even need 3 times a year. So.
Okay, thank you.
I'm Dr. Rose from Sepang, Malaysia. In one of your slides, Dr. Longo, you mentioned about high unsaturated fat. Can you elaborate more on that? What do you mean by unsaturated fat? And basically, we know that saturated fat also are healthy fats, like coconut oil, ghee, grass fat, animal fats. Can you elaborate on that?
Well, I think we got it right. I mean, the idea was let's have a diet that replaces water-only fasting, but let's learn making that diet. Let's learn from the longest-lived people in the world. Okinawa, Sardinia, and all these long-lived areas. So we took the ingredients that were sort of common to all these areas. And, and one of the common one, I mean, Okinawa doesn't use it, but certainly olive oil, for example, and nuts seem to be pretty widely used by this population. So we utilize only those type of fats. So the idea was, we don't know if they're superior in the fasting mimicking properties, but they're certainly so healthy that there must be something superior in the other type of fats. And I think it was the right reasoning, because in this last study that I showed you with Crohn's and colitis, in fact, they were important because they contain prebiotic ingredients that allow the microbiota to, the Lactobacillus bifidobacteria to grow, right? So, yeah, so these unsaturated fats, the healthy ones seem to be a good choice. Now, we're now using coconut oil. For example, in the trial in Italy for Alzheimer's disease, we have a higher calorie fasting mimicking diet that contains coconut oil. And that's because there are some trials suggesting that coconut oil is helping against, the mid-chain fatty acids are helping against cognitive decline. So we'll see what happens. We just started that trial. It's going to take us a year and a half or so. So, we'll see. But, yeah, we do have a saturated, if you will, component of mostly from coconut oil.
Will it be good if we combine both the monounsaturated and also the saturated for both of us who have no problem?
That's what we're doing in that trial. We're combining in the olive oil, the nuts, and the coconut oil. And in that trial, we're not just doing it 5 days a month, but we're giving them a sort of like ketogenic-like supplement every day of those components. Yeah, so that's going to be interesting to see what happens.
Thank you.
Dr. Longo, how speculative is your scientific base when you come up with the conclusions that we can expect to have around 30 years longevity extensions by acting on aging compared to only 12 years if we just curing diabetes, cancers, and type 2 diabetes?
Yeah, so you say in the first slide that 30 years, yeah. I think, this is not to say that we're there yet. This is basically saying that the field of juventology and gerontology can get there. And, there should be an effort by worldwide, and I think we should move away from this, what I call Band-Aid medicine. You wait until somebody's sick and move into, much more. That doesn't mean that, medicine should always be there. I'm not saying, once you do develop cancer, then of course we want everything to be there. But I think that clearly from everything I've shown and everything we've seen and we know, lots of people don't have to develop any disease. So I think that, the 30 extra years, there was something that was just published. And it showed, somebody just sent it to me, it showed that in the United States, poor neighborhoods, in some neighborhoods of the United States, the poor neighborhoods and the richest neighborhoods, they have 30 years of difference in lifespan already, right? So that tells you already that's a reality as of now. The rich ones, even without following the longevity diet, are already living 30 years more than the people just a few miles away, having mostly a different diet, right? Because the rest of it is probably not that different. But yeah, pollution could be, but those are small effects. We think that mostly it's going to be, are you have a bad diet? Are you obese? Have insulin resistance, metabolic syndrome, et cetera, et cetera. Yeah, so that's already a reality in the United States right now, and probably all over the world, right? I would say in Malaysia, I would be surprised if we didn't see the same. Poor neighborhood, and the richest neighborhood, what is the lifespan in one of them? Maybe not 30 years, but yeah. So I think that it's speculation, but it's also based on lots of data, and it's really about a goal that we should set immediately, to get as many people as possible out of the, this high mortality, high disease state and into this longevity state.
So in short, are you saying that to achieve this kind of longevity, we should prolong the FMD, fast mimicking diets?
I mean,
Is
keep
the organ
in mind that I spend, first of all, I give everything, I don't take a penny out of any of this, so everything is donated. But I learn from the top people in the world, Leroy Walford, and I think after these 30 years, actually, of research, the FMD, I think, is definitely one way to go. It's not the only one, meaning that, there's could be other things that can be added to it. For example, the everyday diet, that can really be important. But we also realized as we were doing research that most people are not willing to change their diet long term. And that's really, a fact. Meaning people really love the food that they eat, and they're not likely to give it up. So this is why we say, look, if we can just convince people to do 15 days a year of this, and this needs a doctor, by the way. It needs doctors, it needs nutritionists, it needs a professional to say, okay, you're going to have to change things. I understand you don't want to change your diet, but, at least 3 or 4 times a year, do these 5 days. Yeah, I think that can have a tremendous effect. And then we'll see what else. One thing we're considering now is we're doing a study with metformin in Italy, and we're thinking, can we compare metformin and the FMD and potentially in some ways combine them?
Okay, last questions. When you developing and formulating this FMD dietary food package, are you mainly focusing on protein and glucose or sugar activated pathways such as mTOR, mammalian target of rapamycin, and PKA only?
No, we're focusing on everything, meaning like we're focusing on a laxative property, right? Because, it seems to be important to sort of clear the colon. We're focusing on salts. We're focusing on, protein level, amino acid level, but the type of amino acid you have in there. We're focusing on prebiotics. We're focusing on so many different things. We really bring in technology, but again, respectful of tradition into this. We always say Silicon Valley has just got the technology, and we're trying to say, no, this is not the way to go. And the biohacking is fine as long as you're respectful of tradition. And that's what things Silicon Valley has forgotten, and it's going to do a lot of damage if it doesn't remember that very soon.
Okay, thanks a lot.
Dr. Longo, you mentioned that in the fasting mimicking diet you keep the protein level normal. Is it normal?
No, it's not normal.
It's not normal?
No, it's low protein, but it's low calorie, so it's extremely low protein. Yeah.
Right. How many percent of protein?
It's, I think 9% of the protein, but it's already 50 to 70% calorie restricted. So it's like,
So 9% out of the 900 calories.
2 or 3% of the. It's like 10% of what somebody's normal protein intake would be per day.
And where do you get your protein from in the fasting mimicking diet?
All plant-based, yeah.
Plant-based. Right. Thank you.
Dr. Longo, maybe one last questions.
Okay,
Morning,
will.
Prof.
Yes.
Longo. Dr. Bhuvan from University Technology Malaysia. I would like to ask, does the FMD has the similar effect as ketogenic diet or low-carb diet towards the biogenesis and homeostasis of the mitochondria, and also increasing the uncoupling protein 1 for the increment of brown adipose tissue in the body?
Which diets are you talking about?
I'm asking if the fasting mimicking diet has a similar effect or better effect than a low-carb diet towards increment of brown fat.
Low-carb diet, yeah. Well, low-carb diet, eventually, for those of you that don't know that, it'll kill you early, right? So this is very clearly mice. It'll be very clear, even in meta-analysis, there's a new one from Lancet, which is over and over and over. Low-carb diet, long-term, is a bad idea. Now, let's not confuse low-carb diet with reducing your carb level and your calorie level to one that allows you to keep a normal weight. That's a good solution, but trying to go high protein and high fat, that's about the worst thing you can do. The FMD is completely different. By the way, FMD is about 15 days a year, right? Low carb diet is about 365 days a year. So it's just apples and oranges. I think this idea of revolutionizing people's diet is a mistake, and we keep making the same mistakes, and we made it with the low-fat diet, and now we went low carb, and we're going to learn that there is no culprit. It's not the carbs, it's not the fat. It's really, you need to understand each component, and usually the people that live the longest, if you look at the Lancet meta-analysis, the people that had the 80% carbohydrate diet live just a little bit shorter than the 60%. The ones that had the shortest lifespan had the low carb diet, right? So it's better to have an 80% carb diet, almost all carbs, than to have a low carb diet.
Sorry, I would like to ask an additional element of this. Does it increase your mitochondrial homeostasis and biogenesis? Any difference between low carb diet and FMD?
Yeah, we're looking at that. Of course, it revolutionizes it's not so much, again, the effects of the 5 days have to be regenerative and rejuvenating so that you now have something lasting a long time. So it's really about rebuilding rather than just changing, UCP1 and changing mitochondrial biogenesis. You have to rebuild everything, right? This is what I showed you. Biogenesis of the mitochondria is a little component of this. People always like to focus on one thing, but it's really about how do you rebuild the pancreas, right? How do you rebuild the liver, right? How do you shrink it, and then, so of course, when you re-expand the liver or the pancreas, you have to, also, at the beginning, you have to go autophagy, mitophagy, etc., and then you re-expand it by, activating these genetic programs. So yeah, of course, that's part of it, but that's not the focus.
Okay, thank you.
All right.
On our last, we have the last two questions.
Yeah, that's
Dr.
about
Homer
it.
will be the last question.
Yes.
Hi, Dr. Longo. So you mentioned about the 15 days, which means 5 days, 3 times a year. For a person with not many chronic illnesses, or even for someone on maintenance, is there added benefits if we do it more often? Maybe once a month or once in 2 months?
Yeah, I think that, I don't like this at all, because I think I always say it's a need to do it basis. If you need to do it more than once every 4 months, then yes, then the doctor or somebody should say, you have high blood pressure, high cholesterol, you're overweight, yes, maybe you do it once every 2 months. But what we don't want is everybody jumping on the bandwagon and saying, kind of like calorie restriction, let me just do this every 15 days, because then I'm going to be, 20, if I'm going to go from 50 to 20. That's not a good idea. Why? Because, it could have side effects eventually if you do it too many times. What happens if you shrink and re-expand too many times? For example, one question people always ask is there a depletion of stem cells? I mean, we don't know. We haven't seen any evidence of that. But it's possible, right? What if you did it 100 times a year, or 50 times a year? That is possible. So we say, just do it on a need-to-do-it basis. Yeah, so if you need to do it even once a month for some people, so let's say somebody obese and with an autoimmunity, of course, that will have to be a decision made by an immunologist or a rheumatologist. But they could make the decision, yeah, you need to do it once a month because you have a real problem. And particularly somebody that has a real severe problem and then for whom nothing else is working, that person may have to, the doctor may make the decision, yeah, do it once a month and let's see what happens.
Thank you.
Okay, so last question would be, so we know now how FMD works. Has there been any large-scale trial, or have you been asked or invited to do some large-scale studies in regards to community or some government hospitals? Or
Yeah, absolutely. So we now have 45 clinical trials going all over the world, mostly Europe and the United States. Some of them are very big trials. Now community-wise, we've been thinking about it. And we'd love to do one here in Malaysia. So we've been talking to several doctors before. So I think especially because of the obesity epidemic here and many other places, but here would be a good place to do some of these studies.
Okay, great. Obviously, we have many more questions for Dr. Longo, but we cannot accommodate the time. At this time, can we keep him on the stage for token appreciation? May we invite Dr. Homer Lim and Dr. Matsia for the token of appreciation? And meanwhile, may I ask Miss Caroline Rhodes to try and give us a 3-minute EFT for those who did not benefit from it yesterday? As we are preparing for the next speaker,